Alright, next I'm going to show the evaluation of the fourth digit. There's 5 motions, and the first is A to P, P to A shear, and then lateral to medial, medial lateral shear, lateral to medial, medial lateral tilt, rotation, and distraction. I feel any restrictions with any of those motions, I would adjust the restriction. Okay, so we're going to do all the muscle tests associated with pronation and supination protocol. First, we're going to do the one associated with the medial longitudinal arch, and that's the psoas muscle. And then resist me pushing down. And then the lateral longitudinal arch, which is glute medius. And resist me pushing in. Good. And then feet on the table. And we're going to do the muscle test associated with the anterior longitudinal arch. And that's the quadriceps. And then resist me pushing down. Good. And to find any of those being a grade 4 or less, we would follow pronation or supination protocol. Alright, so I'm going to follow Charette's pronation protocol, and first adjustment will be navicular, and then cuboid, and then the cuneiforms, and then met heads. The talus. And then phalanges. And then calcaneus. And then fibular head.
Grasping the knee, alternative moves. This one's for the talus.
I'm going to do the protocol for supination. And I'm going to do navicular and cuboid. And then, no, that was navicular and cuneiforms. The cuboid. And then I'm going to do talus. And then calcaneus.
Next, I'm going to do the great toe.
And then met heads.
Tarsal. And also the
Phalanges.
bucket slide.
And then fibular head.
Next, I'm going to do assessment.
Alright, I'm going to evaluate the knee. Pull it out, make sure it's all the way in extension. Apply Vergas and Valgus forces. Ask the patient to flip over. And then if I find any movement pushing from lateral to medial, I would adjust medial condyle. And using wrist extension technique. And then if I found movement from medial to lateral, I'd set up on a lateral condyle. Using wrist extension. And then if I found movement in both directions, I would first set up on a medial condyle and then lateral condyle. And then have the patient flip back over. And then I would reevaluate the knee. And find there to be no movement. And then after evaluating the knee and finding there to be movement, for instance, lateral to medial, I'd set up on a medial condyle. medial to lateral movement would be a lateral combo. And then if I had movement in both directions, we'll set up on both sides for posterior tibia. And then have the patient flip back over. And reevaluate the knee, finding there to be no movement. Okay, so I'm going to assess the hip and go ahead and do the rectus femoris muscle test. Lift up your knee, or your leg, and hold that for me. And resist. Good. And if I would find that to be a grade 4 or less, there's two techniques I could use. I could do the posterior glide of the femur and the acetabulum.
That's what I said too when she first said it to me. I was like,
Or I could do the wrist extension technique. And I would retest, and then hold that for me. Good. Resist. Good. And find that to be a grade 5. Okay, so I'm going to show alternate talus adjustments, and the first one is when the patient is prone, and make sure the patient's foot is hanging off and contact where the talus is, and adjust into the table. And then I can also do one where the patient's knee is flexed, and contact calcaneus and do talus lift, and then have the patient flip over. And then I can also do one, scoot up a little bit, or I'm sorry, where the patient's foot is hanging off the table, and I can also adjust in the table that way for the talus. Okay, and then I'm also going to adjust the patella, and I'm going to be looking for any movement restrictions, and then adjust into the restriction, and then make sure I restored movement.
No.
Okay, first I'm going to do the muscle test for tensor fasciae lata. And then resist when I push in. Good. And finding that to be a grade 4 or less, I'd assess internal and external rotation of the hip. So this would be internal rotation of the hip. And if I found restriction, it would be stuck externally, and I'd adjust in that direction. And then if I found to assess external hip rotation, bring the hip into external rotation, find any resistance, that means it was stuck internally, and I would adjust in that direction. And then I would retest, and then resist, and then find that to be a grade 5.